Hello, my name is Julia Chan, and I have my preceptorship on a med-tele floor at Tacoma General.
And my name is Danielle Botts, and I had my preceptorship on the med-tele floor at Providence St. Peter's Hospital.
The title of our capstone is Nursing Care for the Older Adult with Dementia Experiencing Delirium. What started our interest in this topic was that we both had several patients during our preceptorship who were experiencing delirium but were not well managed. They ended up receiving high doses of antipsychotic medications, and one of them at one point was placed in 4-point soft restraints. This raised a lot of ethical questions for us and motivated us to learn about how this situation could have been prevented or better handled. We were surprised to find how prevalent and detrimental delirium was in this patient population, as it affects nearly 40% of hospitalized older adults and increases mortality during and 12 months after the hospital stay. It is also associated with long-term lower cognitive function. But despite its prevalence, the physiology behind this disorder is not well understood. There are many triggers for delirium in older adults, so we decided to focus our assessment and interventions on the 3 most common, which is dehydration, infection, polypharmacy, or new medications.
So there were a lot of interesting points that we found in our research since we're both really passionate about this topic. And one of the first things that we realized is there's actually 2 different forms of delirium. One is hyperactive delirium and one is hypoactive delirium. Hypoactive delirium is not as well researched or diagnosed because the symptoms are more subtle than hyperactive. And so nurses need to be educated on both so that they can recognize either hyper or hypoactive delirium in both of their patients. In our practice and education, we experienced UTIs often being cited as a common cause of delirium in older adults, but we did not learn about a lot of other causes, despite the fact that in our research for this project, we saw a multitude of things that can induce delirium in older adults. This led us to believe that more thorough and comprehensive assessments need to be done when a patient with dementia experiences delirium. We also found that there is a lot of developing work for preventing delirium in patients with dementia that's not that hard to implement in the acute care setting, which is really exciting. These interventions can include something small, such as an All About Me poster, which we talk about in our poster, and the Hospital Elder Life Program, which is a more systematic program that can be implemented on the hospital setting. Either way, these are manageable ways in which the hospital can implement preventative care for at-risk patients. And lastly, in our practice, we saw pharmacological agents such as antipsychotics being used as a first-line intervention for patients who have an onset of delirium. Antipsychotics can actually induce delirium and make the episodes longer. Much of the research supports antipsychotics being used as a last resort option only to be used when patients are at risk for harming themselves or for harming others. And so we decided to focus our interventions more on non-pharmacological ways we can impact the patient before they get to that point.
So our 3 takeaways that we hope people would get from our capstone poster is that nurses should be assessing their at-risk patients for delirium multiple times a day using the CAM assessment. And prevention is the best intervention when it comes to delirium. We should be implementing the preventative work that Danielle talks about for all of our older hospitalized adults. And again, this cannot be said enough. Pharmacological interventions and restraints should be seen as a last resort if there's a risk of injury to the patient or others, and it should be stopped when it is no longer needed.
In the process of us doing this project, we've had a couple of questions from our peers regarding our poster. And one of the most common is, how do we know if the delirium is new onset or if it's actually just the patient is in a later stage of dementia when we don't know the patient that well? And we have to say this is one of the hardest things to distinguish when you don't know the patient very well. I think we as nurses have to be vigilant about discussing the patient's mental status with the family if that's a possible avenue. And then also looking at previous nurses' assessments and notes and collaborating with the rest of the healthcare team that have worked with the patient. We want to acknowledge both of our clinical sites, Providence St. Peter and Tacoma General, for allowing us to precept at their facility. We also want to thank our preceptors, Marlo McMurdy and Matthew Landfar. And lastly, we want to give special thanks to Dr. Dana Zeichkin and Dr. Megan Morrison for the support and guidance throughout this capstone project. Thank you.
Thank you.